We stay with health and people ringing the out-of-hours doctor's service with minor complaints such as blisters on their feet or cold sores on their lip are causing waiting times to increase, says one of our local health trusts. Dr. John Simpson's medical director at the Southern Trust to give us some more examples of what kind of minor complaints are clogging up the system. Good morning, John.
Hello there. Hello.
I mentioned a couple there, blisters and cold sores. Any other sort of instance of sort of irresponsible calls?
Yes, over the winter, obviously, it's the symptoms of cold and flu that people find they have to phone the out-of-hours service. I suppose we're partly to blame for this problem, Connor, in that we should really call this an out-of-hours urgent care service. We're there to answer everyone's needs. However, minor calls, minor ailments, such as we've mentioned, are not urgent. They are problems, but they're not urgent.
Yes.
We try to get back to those within an hour, but we need to get back to people who've got urgent problems, such as shortness of breath, shortness of breath and serious mental illness problems within 20 minutes. And that's a struggle at times. So what we're asking people to do really is to have a stop and think for a moment before you phone the out-of-hours service. Consider going online. We have a very good resource online called Choose Well. If you type in the words Choose Well to the internet, it comes up very quickly. And it's an excellent resource. And there you can learn perhaps how to manage the condition yourself, or you can learn best how to get the best out of the health service.
But I suppose traditionally people have very often booked an appointment with a GP with what might be considered a rather minor complaint. I mean, people take their own health very seriously, and what you say is minor, they might feel is major, I suppose.
That's a good point, and we don't expect people to know the difference, but I think it's our responsibility to try to educate, support, and help people to see, to learn more about what is minor, what is major, and what they can do themselves. So we are probably lacking in how much effort and time we have to put into health promotion and educating the public about health, and that's why it's of benefit, and I'm very grateful to be able to speak on your show this morning about that.
Well, what impact it's having on the service to have to sort of sort out the more important calls from others which might be considered time-wasting?
The impact is usually over peak times, and, for example, coming up to a bank holiday weekend, there's only a certain number of doctors and nurses available. They have to triage, that is, prioritise the calls as well as answer the calls. So if we get a lot of calls which aren't urgent, they still have to be prioritised, they have to be looked at, and they have to eventually be answered. In the meantime, the doctor, the senior nurse, have to get back onto the phone to the person with the urgent problem. And we found that really only about half of the problems that we deal with are those urgent sorts. The other half can be dealt with a few words of advice.